Welcome to the Soulful Surgeon Podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon Podcast. Hi, everyone, and welcome to the Soulful Surgeon Podcast. I'm your host, Dr. Lisa Hunsicker, and this is a place where healthcare workers come to be seen and heard. So it's been a couple weeks since I've seen you all. I took a little bit of time. Remember, we talked about our remedies, and I was working on my physical being. And so I had my birthday. We had a great time and took a couple weeks off, which was a lot of fun. And then we got to celebrate with RSV. And so I took some time off. I had no voice and really felt terrible, but, took a little bit of time off of work and just decided to really be mindful of myself and my health. And so we're back at it. And today I have a wonderful guest. Dr. Sunny Sharma is with us. He is a board certified internal medicine and lifestyle medicine. And this is an interesting conversation that we're going to start off with because at 36, he was diagnosed with a brain tumor. So, Sunny, tell us that's a big step in your practice when you hear that news. Tell us a bit about your practice.
So my practice today versus what it was prior to my brain tumor is completely different. But I traditionally started out in your good old fashioned in old school primary care practice. I would see my patients in the hospital. I would see them in the clinic. I went to skilled nursing facilities. I ended up wearing various administrative hats, the typical overworked physician setup. At the current time, I'm actually a concierge physician that has a focus on lifestyle medicine. I try and emphasize prevention with my patients and overall wellness. In that aspect, I make sure my patient visits are at least 30 minutes long. Some of them go for 2 hours. I do things to try and keep people out of the hospital instead of this reactive approach that we traditionally have.
So what's it like? So you're this practicing physician and one day someone tells you you've got a brain tumor. What is that like?
That was a shock. You never really think it's going to happen to you. Even as a physician, you just see all these crazy diagnoses over time. And as a busy doc, I basically saw everything. And the first thing that comes up when someone tells you, hey, you have a brain tumor is your priorities shift. And you go straight to thinking, okay, what about my wife? What about my kids? What are my kids going to do? They're so young. Are they going to even remember me if something happens? I then went to thinking about my patients as well. I'm like, okay, I'm going to need to take time off if I'm going to need surgery. What are they going to do if they need something? And I just started thinking about the whole picture. And then it's like, why did I work so hard for this to kind of just be the potential end of things? So you do start thinking about, I know it's a little dark, but you do thinking about your demise at that point. Thankfully I didn't have to deal with that, but that does cross your mind.
So when you think about that experience, what do you think was the hardest thing for you to admit to yourself at that point?
The hardest thing to admit to myself was I am a patient as well. I'm not anybody special. I'm not excluded from the idea that I can't get sick. I not only got sick, but I ended up having something more serious than most of my patients do. So that was a tough pill for me to swallow.
It seems like we are in this role all the time, and we are the overseers, in many cases, the advisors of our patients, and we're coordinating all the care. And we're so used to managing patients. What do you think as far as now that you're becoming a patient? What do you feel like that taught you that perhaps, what we learn in medicine has taught us? What do you think being a patient taught you that medicine didn't?
So ironically, being a patient taught me a lot more about being patient in that sense. So oftentimes in the patient visit, I will give orders, say, do these tests. schedule this appointment, and we'll follow up after that. But the time it takes to get scheduled for that next MRI or that surgeon visit, and usually it's just an intro, and then it's like scheduling the surgery afterwards. For me, I was diagnosed in June. I moved very quickly. I was seeing surgeons and receiving multiple opinions within the first few weeks. I had one within the first week. But my surgery wasn't scheduled until September of that same year, even though I made a decision in the end of June, early July. So it taught me how difficult it is for these patients and the mental struggle that they go with.
So do you feel like being a physician was helpful in the scenario, or do you think it was a hindrance in some way for you?
It was both. It was definitely both. So there's the power of knowledge, which is helpful in understanding that I wasn't in immediate danger. But there was also the power of knowledge in the negative aspect, which is the curse of knowledge. And that was just knowing all the things that could potentially go wrong as well. And that was obviously concerning for me. So I lived a little bit of both of those. And oftentimes when I would tell friends and family, there's this assumption that, oh, you're in medicine, so you already know exactly what to do or what the process is going to be. And little do people know that there's a lot of uncertainty even in process when you know the framework and the algorithm and how things are supposed to play out.
Well, I think that we have a laundry list of things that can go wrong in our brain that I think most people don't know. And every time we approach a patient, we're thinking about, okay, here's the issue, but here are the things down the road that could be the issue. And you're always trying to forecast in all the possibilities of things that could go wrong that most people have no idea about and that we're running through our head all the time, except that for you get to you don't get to miss out on that. And so as you're dealing with that, you have every possible complication, every possible weird scenario, because certainly, as you know, there are so many strange situations that happen that, you have your textbook presentation, but you have all these other unusual presentations or unusual other issues that come along the way that nobody else knows about, that you're going to bed, you're sleeping with it, you're waking up with, you're going all day with all these other things that you can think about as possibilities. What do you think about with patients? What do you understand now before all this, comparatively before all this?
So, every physician has a level of empathy, but when you get into the patient role, I think it grows further. And my patients see that and they feel that and they understand that. So when I am sharing something that's difficult or talking about a road to recovery post-operatively, it is a little bit easier for me to have that conversation. I'm like, I've been there. This was a massive surgery. And I was told that there were going to be a lot of complications. There was a high likelihood of it. And there's some of them I continue to live with. And there's others that I didn't have, but I was able to talk about things that I did to help myself through that situation. So it really has helped me on that front by being one that is a patient himself. It's kind of like the idea of it, when people are in administrative medicine, I always think that the ones that are the best are the ones that are clinically practicing as well, because they actually are experiencing it all. So they don't just make a decision and hope everyone else enforces it. They're living through it themselves. And that's what I get to feel as a patient. And I do feel like it made me a better doctor.
Well, I think whenever you get to walk the path, that you're also on the path with all the people that you're talking to and working with in whatever capacity that is. I think that there's so much more flow with that and understanding and capacity, of course, like you said. In thinking about who you were and the kind of physician and the type of practice that you had, and then who you are now, do you feel like you had burnout of any sort prior to this?
Yeah. Yeah. So I definitely had burnout. I'd already made changes at multiple levels of my career. So I started out with this traditional practice, and I was the busiest doctor in my region. And I kept getting those patients, which we call the frequent flyers, the ones that are consistently admitted almost every month, like the heart failures, the COPDs. And I remember there was one day I was just exhausted. I was post call and I went in to see my patient who had heart failure, who I did see every month in the hospital. Talked to him. I was walking out and a pizza delivery guy was walking in. And I stopped the pizza delivery guy. I'm like, wait a minute. Did you mean to go to the nurse's station or the break room? And he's like, no, it was ordered to this room. And he showed me the name and it was my patient's name. And I ended up going in there with the pizza delivery guy and explained to the patient that this was actually what brought him into the hospital in the first place. After talking to him for about an hour, I went down to the cafeteria saying I needed a break. And when I went to go eat, I saw all the patient's family members, the nurses, the doctors, the administrators, all eating the same junk that was kind of putting this individual in the hospital. I lost my appetite, finished my work, went home, and I told my wife it wasn't making a difference. I felt like I was just doing patchwork, and she encouraged me to find something that is going to make a difference then. And I basically stayed up all night trying to find something, and I came across the American College of Lifestyle Medicine. And that day was so pivotal because it shifted me in this direction where I was going to start offloading certain things and start focusing more on the outpatient setting and focus on the prevention aspect. So I already took a step back at that point, but I still maintained the administrative level of things. I took on an administrative role that as a regional medical officer in the middle of the pandemic, which was a lot of stress. I was part of making system-wide protocols for COVID. When we didn't have any testing, it was coming up with protocols for that. Then when we didn't have enough treatment, it was coming up with protocols on that sense. We were dealing with hospitals across other states that were at capacity. People were being helicoptered and transferred across. I actually remember being in a group chat with you at that time, and you were busy in the OR while I was busy in meeting after meeting and strategy meeting as well. So it definitely was reaching a point of burnout, but that I also felt like, well, I worked so hard to get here that I should just appreciate what I'm doing. And that was a mistake. That was a mistake because just because I wanted to be a doctor didn't mean I had to just deal with the consequences of it. So I was definitely at a point of burnout, and I kept trying to find little ways to maybe make it a little bit better, but it wasn't until after my surgery where I made the major changes.
So you were in your regular practice when you got this diagnosis. How did that work with your patients and the business of medicine, of course?
So thankfully, the people I work with, very supportive. The administrative team was actually very helpful. I have a lot of great partners as well. Some of them that I've been trained with. So I trusted them to help cover my patients in that sense. With that being said, up until the last day before I was supposed to travel for my surgery, I was squeezing in every extra patient possible to try and make it that their follow-up would be after I'd come back from surgery. I had the surgery in September. January 1st of the following year, I was back at work. And part of it was I wanted to prove it to myself. But the other part was I felt like I needed to be there, and I needed to be there for the medical community, for my patients, for the organization that supported me. So nobody had directly said that, but it was this feeling that I should be back. So 3.5 months, I was back to seeing 30 to 40 patients a day.
And post-op, did you have any issues that you were having to work through that would
So
get you ready to be able to go back to work?
So I did, since my tumor was so large, it was the size of a golf ball. I ended up with right-sided deafness. I was dealing with chronic fatigue. Balance issue-wise, thankfully, I did okay. A little unsteady here and there, but the fatigue was a big thing. And part of that has kind of lived with me moving forward. So building up the stamina again to having 30 to 40 conversations a day, coming up with the clinical decision-making. And on top of the right side of deafness, I developed tinnitus and hyperacusis. So I had the sensitivity to sounds. I tested out these hearing aids that are cross hearing aids. They almost feel like a microphone in the deaf ear and send the signal to the other side. And it helps with the deafness component, but you can't localize sound. Everything's amplified. So I was able to hear a stapler all the way across the office. So I chose not to wear them. So there were multiple factors that were just really impact me. And I would come home after work and just feel like I needed to collapse.
So at what point after that did you begin to transition to lifestyle medicine? And how is that different from what you're already doing?
So it took a year and a half before I started making a transition toward concierge medicine and focusing more on lifestyle medicine. So I was already trying to practice lifestyle medicine in my primary care practice, even before my surgery. The problem is in our current medical system, a 10 to 15-minute visit, um, having enough time to pinpoint what the lifestyle issues are, talk through a whole nutrition plan, exercise regimen, sleep hygiene, all those type of things. I don't understand how you would do that in 10 to 15 minutes on top of addressing all the acute concerns, all the screening concerns. It was impossible. As I continue to go down this path where, okay, I proved it, I could come back, I could work, I could practice at a high level. I realized that I needed to do more for myself. I needed to get myself healthier, and I needed to practice medicine that I thought was right, and by my patients. So at that point, that's where I started making the transition. And it was a rough transition at that point too, having the conversation with a panel of 3,000 patients to see, obviously not everyone's going to come on board with this, but for those of you that do, these barriers that you've had where I'm booked out for 3 months, where your visits are too short, where you don't feel like you get to address everything, or you feel like you get someone else on call on weekends or on evenings, that all goes away. So it in total, it took about 1.5 to 2 years post-op.
I think that a lot of folks don't really understand how our clinic schedule works and basically the finances of it, right?
Mhm.
And I think most people in traditional primary care who are going to see their physician, and they don't really understand the time constraints that their physician is under because they've got to see, so many patients and there's only so much time in the day and you've got to
Mhm.
be able to squeeze everybody in. And your reimbursements are so poor from the insurance companies that in order to pay your staff, in order to pay your rent, keep your lights on, and be able to show up in a place to treat patients, right? There's a business that goes with that. And I feel like it gets so crammed and you've got to get so much information and really understanding our patients and knowing who they are and knowing what's going on and really delving into the things that you're talking about. There's just no time. And it's just
Mhm.
like, hey, Mr. Jones, what's wrong? Right. And so
Yep.
we try and we get more polished, but really,
Mhm.
you've got 7 minutes to quiz somebody about something that they don't really necessarily know what's wrong with them. And you've got to get from knowing nothing to knowing everything to knowing a plan in 7 minutes, and then get them out the door and be back in the seat in the next 7 minutes and just do this all day
Mhm.
long. And I feel like this is something that has contributed tremendously to burnout.
Mhm.
Not just physicians and the nursing staff and all the advanced providers, but also
Mhm.
patients are burnt out from us because
Mhm.
we want more time, they want more time, and we have all this third party insurance
Mhm.
conflict that we can't get paid for our time. And so I feel like this model that you're talking about really is a great answer to the question
Mhm.
for patients and for physicians where you want more time with your patients. We as
Mhm.
patients want more time with our teams. And if we step out of that model and we just choose that, then I think that gives us all the things we want and really slows it down and allows us to be much more thorough as a healthcare team.
Mhm. Mhm. Yeah, exactly. Obviously there is the upfront cost that people end up paying, and that's usually the biggest thing that deters people. But realistically, for most of my patients, I feel like I've been saving them money down the road. I had a patient that they called me and they're like, I'm on my way to the ER. I have abdominal pain. I knew their history. I knew they had a history of diverticulitis, recurrent over and over again. And I was in the office. I was like, my office is right there. Instead of going to the ER, waiting for the 8 hours, why'd you come to me? Come to the office. I'll assess you and see if we could just initiate your treatment. I did that. I started on antibiotics. I checked in on her the next day because I had time to do that because I didn't have 30 patients waiting for me. I checked on her the day after that with another call. And then I checked in again the following day, and she was improving and had her slowly start advancing her diet in that type of way. I was able to keep her out of an ER visit. So saving her that high copay that you traditionally end up having. Plus I had her staying in the comfort of her home. And then that's just the latest example. I've done that multiple times with patients where I kept them out of immediate cares, ERs, hospitals, or they were seeing a hospitalist and they were more comfortable discharging them a little earlier, knowing that I would be able to get them in next day or even daily if I needed to reassess something, if I had to change bandages or dressings, if there was something that was done like wounds. It's just been great for these patients. And then with the added counseling I've been able to do for these patients, many of them are getting off of medications. They're lowering their doses and they're not paying as much for that, or they don't need as much testing, or they don't need to go to a specialist for every little thing anymore. I do a lot of the basic joint injections, and I do manage a lot of cardiac cases as well. Obviously, it doesn't say that I'm replacing a specialist, but for some of these patients, it makes it easier. They don't have that extra copay, that extra visit that they have to try and coordinate or take a day off from work. It's been great.
Well, I think you have such an incredible breadth of knowledge. I think that one of the great things that we struggle with in healthcare is that everyone is siloed, right? Because we have all these
Mhm.
specialists. I'm a specialist. And what ends
Mhm.
up happening, it sometimes, at least it feels like to me, it's almost like this hot potato. And
Mhm.
the potation, the potation, the patient,
Mhm.
the
Good.
patient, right? They come see me and then they come see you and then they go see other specialists, but there's no
Mhm.
continuity of what's happening. And so I'm getting a little bit of the story and you're getting a little bit of the story and someone else is getting a little bit of the story. And then they go to the hospital and then that story happens, but you and I don't necessarily have that. And so there's all these
Mhm.
little bits in a puzzle that never get put together. And so I feel like your approach is fantastic because you're keeping all the pieces together and you're managing that as
Mhm.
well. So, yes, if they do have to go to a specialist, you're involved in that so that
Mhm.
the storyline of what's happening to them is very consistent and complete and you're aware of all the pieces of it. So, I think it helps
Mhm.
you one get to whatever diagnosis you're trying to get to, treat whatever issue you're trying to treat, but also manage the experience and the care of the patient because ultimately that experience is going to have a lasting effect, not just on their diagnosis, but on their experience with us as well. And I feel like this silo effect that we have, it's so separate. It just keeps us all away from each other. I think you're taking that and keeping it all together so it's much more
Mhm.
fluid, and I think it benefits the patient in a tremendous way.
Yeah, I often compare like healthcare to like football, and I feel like the old school primary care doctor used to quarterback the care and would distribute. And there was a lot more communication, and you would think that there was luster in the era prior to EMRs, but doctors actually had to talk and they had to communicate, and they did want to as well because they weren't overburdened by all the little check boxes in the EMR. Now I feel like a lot of primary care has become more of like the unskilled quarterback that has to constantly hand off all the time. So you're not really controlling anything in the game. You're just handing it off. And so I'm trying to take a step back and go back to being like a Peyton Manning, someone that really did know everything that was going on, was able to read through the defense and knew exactly what the strengths of everybody were. And in the end of the day, that was the best thing for the team. And the team in this case is the care team for the patient.
So now that you're in lifestyle medicine, what is it that you do for yourself
Mhm.
that you weren't doing before? What are the focuses on your own health and wellness that maybe that you are doing? And really, what does health mean to you now after all this?
Mhm. So instead of wearing that badge of honor of burnout and I work so many hours, I'm finding myself on knowing when to shut things down, leave the office, go spend time with my family. So one of the big pillars of lifestyle medicine that's very underrated, we obviously always talk about exercise and nutrition, is mindfulness and social connection. And part of that connection is with your family and your friends. And if you're burnt out all the time, or you don't have time to hang out with anyone, or you come home and you're just frustrated because work was so rough, it takes away from that actual meaningful connection that you have. So that is something I've emphasized. I went back to reprioritizing sleep, which is something I've not done since I entered the medical field. And I'm talking back in medical school that I ditched sleep because I needed to study every waking second. And then on top of that, I'm back to prioritizing healthy eating, making sure I'm exercising again as well. Since the surgery to roughly around now, I've lost about 75 pounds because of various changes I made. And these were things that I should have done in the first place. I'm back to what my college size was. I was able to run the Chicago Marathon 25 months after brain surgery. And I'm not a runner. I've never run a marathon before in my life, but it was another one of those I had to prove it to myself. But as I started reprioritizing my own lifestyle and making sure that I'm well enough to take care of people, I I did something that just was unheard of. So I'm actually wearing the shirt that my wife made for me. It's a finisher shirt. And it has actually my on the side here, it says Sharma strong. That was kind of my rally cry when I was diagnosed with a brain tumor and I was going to go in. That was kind of became my hashtag for the internet for people that wanted to follow the story, but also just something I kept promoting, and also the name of my corporation as well.
And that's great that she made that shirt for you. And, and it's great too because you're able to share that with your patients as well, and they can follow you. I think it's a wonderful model. I think we talk the talk a lot
Mhm.
in our practices, but we don't necessarily walk the walk. And when you see similar to what you were talking about, because this happens as well, you see your colleagues who are, making poor choices in lifestyle and not sleeping. I'm married to a trauma surgeon. And so,
Oof.
I'm exposed to that community where, the whole idea of being on call for 24 hours and then working another day is that's just their normal. And we know, right? We know the literature of that sleep is
Mhm.
so critical. And yet they're doing all the things to heal their patients, but doing all the things to harm themselves. And we haven't given ourselves permission to actually do that because, and I don't know what you think, but our training is so self-deprecating, and you don't need to sleep. You don't need to eat. You don't need to go to the bathroom. You
Mhm.
don't need to have connections to
Mhm.
family and friends. And then you get ingrained in that and you get trained very well at that. And then
Mhm.
all of a sudden, here you are, you're 25 years into practice and you're overweight, you have heart issues, you're not exercising, you don't sleep, and you're completely isolated because you're so embedded in medicine that you can't really get out. And it's interesting, even reading dementia, like this is just a common thing when we talk about dementia and people being socially isolated and depression and leading to dementia. And here we are,
Mhm.
like, we're
Mhm.
cultivating that
Mhm.
through the usual way of practicing medicine. And how do you talk to your colleagues knowing all this?
So I still hold an administrative role. So I am a part of a lot of meetings, and I like being in my administrative role because I also get to be a voice for the physicians. Like I said, being the practicing physician that's in there, you can actually be on the ground floor and hear what the complaints are, the issues are, but also hear administratively why certain things need to be implemented. Well, we have to do this because we're not getting paid for this anymore. like, okay, that makes sense. We have to pay our bills in that way. But also I get to come in from a physician level. I'm like, you add this extra measure on here to help us with value-based care. But the reality is you're adding to the burnout. So you need to find some way to mitigate some of those things for the physicians. I do encourage many of them to go out and take care of their health as well. When it comes to various dinners and lunches, which, all the dinners that doctors go to are probably some of the most unhealthy ones. I do traditionally encourage that there at least be some healthy apps or starters or things like that to kind of get people involved. We've also started various like walking groups and running groups in the area as well. I was considering starting one this spring officially, like as a walk with the doc situation. But I wanted it to be not just for the patient, but also something to build a community and encourage other specialists and everyone to get together too, to make sure that we're all connected. But when I see other docs that are just sitting there tired, and especially the ones that are picking up extra shifts, he's like, well, I want to make more money, or I want to do this and then I'll retire early. I'm like, well, you also want to be in good enough shape so that you can enjoy retirement as well. But I remind people about that there's so many regulations for pilots to make sure that pilots are getting enough rest. They can't legally fly unless they get appropriate rest. And here we are pushing doctors, and I especially think about surgeons, like you mentioned, trauma surgeon, that those hours, I want these people on the top of their game. I want them rested. I want them in a good place. I would do brain surgery. I would not have wanted my neurosurgeon to have been at the tail end of a 36-hour call going in and doing craniotomy at that point. So I do encourage the docs. I'm like, think about it this way, that extra income, if you don't necessarily need it, maybe prioritize other aspects of your life.
Well, I think that extra income is going to be spent on your healthcare costs long
Exactly.
term.
Exactly. And that's what ends up happening. There's so many times I've seen these doctors working until the tail end and they retire, and you end up just hearing from like a newsletter or posting that, this doctor passed away a couple of years after they retired. And they didn't even get to enjoy that retirement, that time with their family and their friends. And I also encourage people of like this idea of, I'll enjoy life when I retire, but we should be doing it at the same time as well. We should be having our hobbies and things like that. I'll admit, I'm still not the greatest at it because most of my hobbies revolve around doing whatever my kids want to do. They're 5.5 and 6.5, and but that's different. They're at a young age, and I do have various barriers in that way. But I am still trying to get better with myself in the sense that you don't want to put off the joy and happiness. You want to implement it now.
I had a very early experience with that when I went into practice right after I finished my fellowship and started practice. There was a plastic surgeon who had been in town for years and years and years, and he was at the end of his career, and his wife was his nurse, and she had really been talking with him for years about, you've got to retire. Like, we need to go do stuff. And his whole plan was he was going to work until he couldn't, and then he was going to retire, and they were going to do all these things. And so as I was coming into practice, he was winding down his practice. He ended up with a very nice deal where he could sell his office. He could take call and see patients out of the hospital and the ER. And he could take call once a week. So it was a gentle transition. But it was almost immediate, exactly like you're talking about. When that happened, he stroked.
Mm-hmm.
And then this ended up being a long goodbye for him where he was impaired incredibly. And so that never happened. And so for me, that was such a big imprint that I can't wait. I have to start doing things now. And, in medicine, we know, tomorrow is not guaranteed. So that was such a big impact for me that really made me pay attention to that. But I do feel like as a community, we don't really recognize that. And I think we have to give each other permission. Because I think we've been trained to sacrifice and sacrifice and sacrifice. And, when you start thinking about it, all you need to do is give your permission and decide to do it, right? We're all autonomous practitioners, but the society and the community to which we practice in It's like you need someone to tell you, oh my gosh, you need to take time. You need to take time off to go have a brain tumor treated, right? Like, and
Yep.
the fact that we have to consider somebody else's opinion to allow us to take care of ourselves really speaks to the nature of where our problem really lies. And I think that what you're doing really speaks to that.
Yeah, I actually remember in medical school, I was in a family medicine rotation, and the attending that I was working under was actually going to go leave the country for a week. And he refused to tell the patients at that time that he was going on vacation, because what he told me was, he was like, people have this impression that doctors make plenty of money and they should be available all the time. So if you start telling them that you're taking time off on vacation, they start thinking, oh, okay, maybe he's making too much or things like that. That kind of stuck with me, and I did not like that approach. I openly talk to my patients now about time off that I'm going to take and why. But that was something that did stick with me at that time. Like, okay, maybe I do need to make sure that everyone knows I'm just working, and putting all this time in. But that is just going to lead you to burnout, and you're trying to hide the things that are bringing you joy. That's just not appropriate. My current office, my main wall that I have this giant sign that says "More than a doctor" at the top, and then I had pictures of my family via sporting events, pictures of me from the marathon. I'm trying to show, like, I am more than just like the person that's going to give you a prescription and things like that. This is my life. This is a homey environment. This is a cozy environment. I want people comfortable coming in here, because not only am I going to make sure that your life is good, but I am making sure that I'm living a good life as well.
Well, I think it allows patients to connect with you on a very personal level, which I think we've been trained to be impersonal and keep a barrier, but I think it's been to our detriment because people don't look at us as human beings, and we really are human doings to them, but we really need to be human beings. And I know in my practice, the patients know I love Costa Rica. And so when I'm seeing my patients over the course of decades, in some
hmm
cases with my cancer patients, they're checking in with me. How are you? How are you doing? How's your son? He's in college. Oh my
hmm
gosh, I can't believe he's already grown. And have you been to, so it's really two human beings coming together. And then,
hmm
yes, we're going to address what they're there for, but it allows them to see you as a real person as well. So I think it keeps a relationship that I feel like we've sorely missed.
Yeah, and that's another problem with the traditional primary care of 10 to 15 minutes. I wasn't able to have that, and I love those conversations. I also like knowing about my patients' kids, their grandkids, their pets, their travel, other various things. I love seeing the pictures and all that stuff too. So it really is a deeper connection in that way. And um, obviously, I want all my patients to be healthy and live well. But if my patients have passed away, I am the guy that I go to the wakes or the funerals, if it is open to people outside of just family. And a lot of the patient's family members, which I take care of huge families as well, most of them appreciate the fact that I did do that. But for me, I became close with these people. And for me, I just feel like I'm paying my respects and to someone that became a bit of a friend.
Right. So when we think about all the things that we do in medicine, there's often times where there's just crazy, funny things that happen to us that no one
Mhm.
would believe. So thinking about, I mean, you have tremendous experience in medicine now. Any kind of funny, strange experiences that have occurred?
I honestly, for those of us that work in healthcare, almost every day is funny in some way or shape or form. Obviously, I told that story about the pizza, which a lot of people have trouble believing, but it's true. And sadly, that wasn't the only time that I'd seen a delivery come to the hospital. But this one's, I'm going to actually take it back to when I was at the tail end of my training. It was one of my last calls as a resident, and I had medical students with me. And I remember there's this one patient. The previous day, he ended up having a heart attack. He coded, brought him back, and he had this anoxic brain injury, and he was very angry, very upset. security was having trouble holding him down, and I was walking by and everyone was just yelling from the outside. I went into the room and I went in there to help them out, to get the mitts on and help him be restrained. And right then and there, his hand went through and punched me in the face and knocked my glasses off my face. And he said, "Yeah, B word," to me. And I was like, "Oh, I cannot wait to be done with this." But that same night, it was the morning at that point. I was pre-rounding with the medical students and the interns. And I saw this nurse run out of the room and she's yelling, "No, no, 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 no." And I ran to the room and there was another patient that was actually going through alcohol withdrawal and delirium tremens. And he actually looked at her, looked at me, yelled something in Spanish, and then ran headfirst into the window. And it cracked the window, but he didn't go through, thankfully. I had to grab him, pick him up, and tackle him down onto the bed so that we could get him the appropriate meds at that point. This was my second to last call. A week later, both these patients on the same day, I bump into them at the elevator on the way out. The one with the anoxic brain injury, he was fine. He was remembering things, but he had no idea what he had done to me. Same with the person with the delirium tremens. He was through everything. He was fine. He was calm. They were very pleasant, asked if they could push the button for me. And I was like, both of you have no idea what you did to me and the pain and torture you caused me.
Yeah, I think patients sometimes have no idea what's going on. I know personally, I've been punched in the face when patients have just a really crazy wake up from the OR, and they're just waking up and emerging out of anesthesia. They have no idea where they're at, and so it's not intentional in any way. They're just not totally with it. So, well, Sonny, thank you so much for joining us today. You know, when I hear about your health, and I think the one thing that we know is that health is not certain, and I think we have to put a lot of effort into it. But I think the other thing is that this incredible hardship that occurs has really transformed you. And in many cases, I have patients who tell me that cancer was the best thing that ever happened to them. And so as we're continuing to practice and we're continuing to move forward, I just encourage everyone to please take care of yourself and really listen to your body and give yourself the things that you need and treat yourself like you do your kids, because I feel like we work so hard and are focused on taking such great care of our kids that we don't do that for ourselves. So, Sonny, thank you so much for joining us, and we'll see you next time. If you enjoy Soulful Surgeon, please share the podcast with your colleagues. You can find us on soulfulsurgeon.com, and of course, we're on the socials too. So we'll see you next time. Take care.
Thanks for having me. Bye.
Thank you for joining me on the Soulful Surgeon podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at Soulful Surgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.